Thank you. Good morning, everyone, and thank you for attending the July 15th, 2021 Joint Board of Health and Hospitals board meeting. I'd officially like to call the meeting to order. And the next agenda item is to approve the Zoom video from June 18th, 2021 to serve as our minutes from that meeting. May I have a motion to approve that video for our meeting minutes from our last meeting?
So moved.
Second.
Thank you. So our minutes are approved, and our next agenda item is 19 update for test vaccine distribution by Dr. Eccles.
Good morning, board. I am having some technical difficulties. Can you give me a couple of minutes? Okay. As we all know, that things have changed pretty rapidly across for the state of Missouri as it relates to COVID-19 cases and the spread of SARS-CoV-2, in particular the variant of concern, not only for the state, but for the CDC and our other international partners, is the Delta variant, which has been shown to spread more effectively and be more virulent than the previous strains. However, the focus for the health department remains interrupting transmission. We know that if we effectively interrupt transmission, the likelihood of new variants developing is significantly reduced, and we can preserve lives. And so our focus isn't on a particular variant, because we know that in addition to the Delta variant, there are several other variants circulating in the United States and other variants circulating in the world, such as the Lambda variant, which is really taking South America by storm. That could easily be introduced into the United States and interrupt the health of our residents. And so instead of focusing on a particular variant, our focus is really on remains to be on stopping transmission or interrupting transmission. I do want to share a few slides which were prepared by our epidemiology department. You can let me know when you can see my screen. Great. And so if you look at the cases that are being reported in the city of St. Louis, I will see that the areas with over the last 2 weeks, the areas that have the highest case rates are those areas in the northern part of the city. So 631, 115, 113, 106, 102, and 102, which are also areas that have some of the lowest vaccination uptake. We also know that these particular areas are more populated with minorities, which again speaks to the not only the transmission that we're seeing as far as numbers. So when we look at the demographic data, we see that African Americans are accounting for about 80% of the cases. But we know that these areas are predominantly African American, also that they have high levels of poverty. You have more individuals in this area that have underlying medical conditions. So individuals who are in these areas not only remain susceptible to COVID-19 infection, but also severe complications if they are infected. And so the health department is doing more outreach in the city, in the northern part of the city. We're partnering with agencies and community-based organizations to make COVID-19 vaccines available, doing special events in that part of the city. We'll also be working with organizations to do additional outreach and canvassing in that part of the city as well. When we look at case density by neighborhood, what we're seeing is that there's more activity, not only in the northern part of the city, but also in the southern part of the city, particularly in the areas that have lower vaccine uptake in the southern part of the city, so 63111 and 63 zip code 63118, which are highlighted here, are zip codes that we've seen, again, some of the lowest vaccine uptake in the southern part of the city, but they're also having an increase in COVID-19 activity. But again, it's really all over the city of St. Louis. And so the concern is, knowing that we have less than 50% of our population who has received at least one dose of a COVID-19 vaccine, rampant spread of the Delta variant or other variants could really overwhelm the public health system and the hospital system. Because we know that after we see an increase in cases, we typically see an increase in hospitalizations. And we're already seeing that in the city of St. Louis, the St. Louis Metropolitan Pandemic Task Force hospitals, according to the data, there's been a 60% increase in hospitalizations related to COVID-19. Again, it's density by ward over the last month and the last 2 weeks. Again, there's hotspots across the city, and so in the northern and southern parts of the city, which is of concern, because again, we know that a significant percentage of our population remains unvaccinated. Okay. So my computer's freezing, so I'm just going to go through the information. So when we look at the demographic data, we know that African Americans continue to account for about 80% of the COVID-19 cases in the city of St. Louis. One change that we have seen is that males are accounting for over 50% of the COVID-19 cases in the city of St. Louis thus far in July. And so that's a change that we've seen in the past. So in the over the previous months, females have accounted for over 50% of the cases. So I know that there's been roughly about a 3% increase in testing in the city of St. Louis. About a 3% increase in testing, but we're seeing that more males are being tested, or accounting for a greater percentage of cases in the city of St. Louis. And we're also looking at which age groups are impacted. So early on, we know that the elderly were really experiencing the heaviest burden of COVID-19 cases. Over time, that shifted to the younger population, potentially those 20 to 39 years of age. And what we're seeing now is an increase in those in younger populations. So those in the age group of 0 to 19 are accounting for about 30% of the COVID-19 cases in the city of St. Louis, which is of concern, again, because we know that individuals younger than the age of 12 remain ineligible to receive a COVID-19 vaccine. And so we have to do take the measures necessary to protect that population as best we can. We also know that for the youth who are eligible to receive the vaccine, particularly in some minority communities, parents remain hesitant to vaccinate their children for a variety of reasons. Some is misinformation. Some parents are concerned about some of the data has come out around related to myocarditis, and some other complications related to the COVID-19 vaccine that have been highlighted in the media. And so we're getting at this point in time, we're receiving more one-off requests for information from families rather than large groups. And so we're doing our very best to make sure that they're well informed and about the vaccines that are available. We look at school-age youth, so we have a really good working relationship with the school systems in the city of St. Louis, and so we are working with them to plan reopening in the fall. Again, the focus for the infection control guidance that was issued for the school systems in the city of St. Louis last year, before schools reopened, was really focused on interrupting transmission and preventing the spread of not only COVID-19, but other communicable diseases that spread via respiratory droplets. And so that focus remains the same. We will be updating some of the reopening guidance, particularly to make them more in alignment with some of the most recent CDC recommendations. Earlier this year, the schools did move from 6 feet to 3 feet of distance between students and classroom, based off of a study that was done in Massachusetts. And we'll be, last year we had students who are in grade 3 through 12 wear face coverings, but this year we'll be lowering that and making sure individuals age 5 and above in school systems wear face coverings. We saw a very little transmission in schools last year. Most of the exposures occurred in the community when they were attending either family events or events with friends. And so then we'll be doing more messaging with the school systems to inform parents about the steps that they need to take to protect the health of their children and the community. When we look at the reproductive number by age group, what we're seeing right now, again, as I mentioned before, is we're seeing more transmission amongst those individuals who are age 0 to 19, which is different from what we've really seen in the past. They've kind of lagged behind the older populations, but we're seeing an uptick in transmission amongst that age group at this point. And so they're approaching RE of 1.5. We're also seeing an increase in those individuals, the age groups 20 to 39 and then 40 to 59. And they're approaching, their RE is approaching 1.25. And so again, there's increased transmission in the city of St. Louis. And so we're really mindful of the impact that could have not only on the public health system, but on the hospital system if that continues. So we're doing our very best to deploy resources and get information out to the community to interrupt transmission as best we can. Also look at reproductive number by race. So we know that, so although it's trending down for African Americans, it's still higher than what we want it to be. So for African Americans and Caucasians, the RE is around 1.25. Again, this is shows that there's increased transmission and increased spread of COVID-19 in our jurisdiction across races. The big concern is everyone has kind of been talking about is the Delta variant. So in the state of Missouri, the Delta variant is accounting for, just based on its most current data, 73.3% of all COVID-19 cases in the state of Missouri. We also know that the Delta variant has been detected in every region of the state of Missouri through the Missouri Department of Health and Senior Services sewer shed testing program. And so we are working to utilize that data as best we can, although none of the sewage treatment facilities that are included in that study serve as catchment areas for the city and the county. We make sure that information is shared with our counterparts in St. Louis County. We were approached by a group that's been funded by Department of Health and Human Services and the CDC to conduct additional testing for sewage. And so they'll be working with the Missouri Sewer District to collect additional samples. Again, the information that will be provided to the health department will include city and county data, or be relevant for the city and the county. And so we'll be working with the St. Louis County Department of Public Health to make sure they are well informed and receive that information as well. Look at vaccine administration. Again, right now we're lower than we want to be. Roughly 46.3% of St. Louis City residents have at least initiated COVID-19 vaccination, and only roughly 40% have completed COVID-19 vaccination. So there's still a lot of work to do to address the lower than desired vaccine uptake. We'll look at vaccine uptake, vaccine administration by race. The vaccine administered, Caucasians have accounted for the majority of vaccine doses that have been administered. However, of concern is that since the very beginning of the pandemic, the percent population vaccinated per day has really been the lowest for the African American population. Again, this population is disproportionately affected not only by COVID-19, but other chronic illnesses that put them at increased risk for severe complications and death. And we look at the geographic distribution of COVID-19 vaccine. Again, the concern is those zip codes in the northern part of the city are really lagging behind, as well as zip code 63111, significantly lagging behind some of the other zip codes. And so those will serve as focus areas for us over the upcoming weeks and months, especially as we approach the fall season, where we expect to see an increase in transmission of not only COVID-19, but other respiratory illness such as the flu, the common cold. We're also seeing an uptick in rhinovirus cases that are being reported anecdotally from community members. So, and quite a few of those members are reporting developing pneumonia as well. And so we are, that's on our radar, as well as we move forward and prepare for the fall and winter seasons. I'll take any questions if there are questions at this point in time.
Thank you, Dr. Eccles. Any questions or comments from the board or from our guests? Or
The issue always remains communication strategies, particularly to address the unvaccinated. And I think that the health department has really been on the forefront and have been out there doing the right things. We raised this question before about the interface with organizations such as Prepare STL and having them recalibrate their messaging. Can you give us a sense of how well that's going?
Yes, so the health department, we've been participating in those calls. We've met with the Missouri Foundation for Health, as well as the Regional Health Commission, which has a table where the RRT and Prepare STL both participate. So that was a discussion about the Delta variant or messaging for the Delta variant on Tuesday. And we informed them at that time that our approach was not just to focus on the Delta variant, because what'll happen is we'll end up chasing variants versus focusing on transmission. And so the group, there was a consensus that the approach that the health department was taking was appropriate. And that's going to be really the focus, hopefully the focus for that group as well. So we can streamline our messaging to not just focus on a particular variant, but focus on interrupting transmission. So there are efforts being made to streamline communication across the different communication platforms. Missouri Foundation for Health has really vocalized their support. The health department to help us reach additional individuals. And then again, streamlining our message across the city, the county, and other parts of the St. Louis region will be really important as well. I know that Kim and Harold also participated in the JIC meeting, of the PIO meeting, and that this information was discussed with them as well. So we're hoping that not only on the Missouri side, but also on the Illinois side, that we'll be able to streamline our messaging as efficiently as we can.
That's very reassuring. Thanks.
Eccles?
Yes.
Yeah, thanks for your report and those slides. I had the same kind of question that Dr. Ross did, but we all know that from the news that the Delta variant is probably hottest. It's hot around the whole country, but it's hottest in the southwest portion of the state. And I get the sense, I just sort of want to hear you talk through it, that this may have taken off maybe with the July 4th holiday, and maybe people moving around, especially younger folks that are less vaccinated. And I just want to know whether you get the sense that this is going to continue to rise for a while with people moving around, especially in the summer months, and with we have some pretty hot spots in the rest of the state and around the country. What's your sense of where we're headed in a trajectory in this?
So based on what we're seeing, the uptick in cases will likely continue. And I'll say that because as things have reopened, nothing is really clamped down, right? So people are still moving about. A lot of people aren't wearing face covering. We know that some parts of the state, it's almost taboo to wear a face covering. And then we have low vaccination rates across, not just in the city of St. Louis, but across the state. When we look at some of the counties that were adjacent to Greene County, the vaccination uptake rate was around 13%. So there's a significant percentage of the population that remains unvaccinated. And then we have, in the city of St. Louis, we're more urban. And so we have a focus on, the minorities who live in close settings, if you will, that have high poverty and other issues, and also issues of past history that's resulting in them remaining hesitant. But there's also another population that we have to be mindful of, and those are what we would consider the Caucasian conservatives. So those are also individuals that are reluctant to get vaccinated. And so how do we streamline? One of the questions as we talk with some of our partners is, how do we develop messaging that reaches both sets of both groups, and something that's really transcends all populations within our jurisdiction? And so that really has to be a priority. And I think as we look at the what's happening not only nationally and across the world, we have to really do a better job of engaging them. And I think our engagement has to be really comprehensive. It can't just be radio or media. It also has to be that one-on-one contact. And so having the canvassers go out into the community and work with individuals, having those more intimate conversations to really hear individuals is really important. As I've started doing that, as I'm out in the community, one of the things that younger people have said is, It's not that they don't believe that COVID-19 exists, or that they don't believe that the vaccines are good tools to save lives. But when they saw what was being portrayed in the media, the media portrayed things as individuals dropping as flies. And then when they went out to Walmart and I said, hey, people are doing all right. It's not as bad as the media portrays it to be. And so then they said, wait, it's not as bad. And so their desire to receive a vaccine had waned. And so that's something that we really have to work really more closely with our media partners on, is to make sure that we're all saying the same message and that we aren't using the scare tactics. Because when we use the scare tactics and an individual's experience doesn't correlate with what's being said, that can really do more harm than good. And that's what I think we're seeing with the younger population, is that when they were out protesting with the different events, especially after the George Floyd incident that occurred, as well as some of the other incidents, they said, it wasn't as bad as the media portrayed it to be. And so they had just opted to wait.
Do we have any additional questions or for Dr. Eccles? Any comments?
There, Dr. Blue, there's one more thing. So with the health department, so we did receive ARPA funding. So the health department will receive roughly $11,250,000 in ARPA fund. There was one amendment that was made by the Board of Aldermen to put more monies allocate more funding to the health department for incentives for vaccination. I think that's another discussion for us. But the funding, if I can share my screen one more time, I'll do this. So the categories that the health department received funding for canvassing community outreach, so we received $500,000 to go for that category, $1 million for community health workers, $2.25 million for behavioral health providers, $5 million for community violence intervention programs, $1 million for youth-led programming, $1 million for mobile vaccination clinics, and $500,000 for vaccination education and marketing. And again, additional funding was allocated to the health department for incentives, and so that is not reflected in this total.
Dr. Eccles?
Yes.
So I assume this is one-time funding because this is ARP funding, right?
It is.
Yeah. And is this, it just flashed on the screen really quickly, and I'm sorry for not following this more closely, but all that looks like it's aimed at, maybe appropriately, at the COVID outbreak, right?
Right. So a lot of mitigation of some of the consequences, particularly for behavioral health. So we wanted to make sure that there was funding for behavioral health resources for the community, because we know that a lot of individuals, particularly in our minority population, have been traumatized by some of the mitigation measures, and then the loss of employment. Some individuals lost loved ones, and then in depression and other mental health illnesses really peaked or increased over the course of the pandemic as a result of some of the mitigation measures that we had to implement.
Yeah, that was going to be kind of the direction of my question was, I've seen a couple articles in JAMA or in New England Journal of Medicine or whatever in the last few weeks that, we maybe would have hoped that some of the deaths by other sources might have dropped during the pandemic, but it hasn't really happened. Deaths except for suicide in one story I read that appeared not to significantly increase, but we've talked about the mental health problems increasing during COVID. There's been violence increasing, lots of homicides and unintentional injuries. Interestingly, motor vehicle accidents dropped in the first couple of months, but then have been up again. So, other sort of public health things we sort of have not talked so much about while we've been talking about COVID are not off the plate so much, but maybe these dollars will help, especially in the mental health side. I'm glad to see that.
Yes, although COVID has been at the forefront, there's been a lot of different efforts to address some of the other public health issues. So the health department is also overseeing the implementation of cure violence. And so far, the data that we've collected shows that the programs have been effective in reducing acts of gun violence. When we categorize gun violence or firearm violence as assaults, robberies, and homicides. So there's been decreases in all the catchment areas where care balance is being implemented. We hope to have an updated report for the board as well as other stakeholders at the end of this month or early August to cover the first 6-7 months of the year, so that you all can see how what the trends are for violence prevention. But again, there's a lot more work to be done, because although there's been a reduction in the catchment areas, outside of the catchment areas, we've actually seen an uptick in gun violence activity. And so that speaks to the need to really potentially expand the program. But we want to make sure that if we decide to expand the program, we have the data available to support it. So we'll be working with Washington University to actually formally evaluate the implementation of cure violence in the city of St. Louis as well.
So I think I heard you say that it's a one-time allocation or investment, but what's the duration of time that you have to actually spend it?
So the opera fund, so there's $517 million that were allocated to the city of St. Louis. We have until December 31st of 2026, if I'm not mistaken, to spend down all of the funds. The first allocation was roughly $153 million and so this initial allocation is what was passed in Board Bill 2, which was, I believe, adopted on yesterday or Tuesday.
So I think that's important to keep in mind, because when we talk about a public health approach to violence prevention, a lot of it is looking at long-term systemic issues and having the time to actually investigate what works the best and to test and to replicate is a different approach than we would have to take if this were public safety funding. So I would encourage us, as we're looking at those line items specifically, to really think about how we can start to address root causes with longer term strategies.
Thank you for making that point, Serena. Much appreciated. Any comments or other discussion? Thank you. Let's move to the next agenda item, which will be the DOH ARPA allocation. We just talked about that a little bit.
I think we just talked about it.
Yeah, any additional, yeah, we did talk about it, but any additional information about that? Is that?
That's really it for now. One of the things, I know that incentives was something that was added to the health department. And so that's, that can be a touchy topic, especially when you are dealing with people who are just hesitant for a variety, for different reasons. So what we've, based on my personal experience with individuals in the community, it wasn't necessarily that they wanted an incentive or a gift or anything to receive the vaccine. They just had questions. They had serious questions about what the vaccine meant for them and their families. Some of them needed more information about the data. Sometimes we assume that people are just accessing the health department's website or these other resources, but some people had questions about how do I navigate to actually get more information about the vaccines that are available. So there's some really serious questions that the community members have, and we don't want to trivialize their question or minimize their concerns by just giving them a gift card for food or utility assistance or whatever it may be. We really want to make sure that we're hearing them, because if we don't hear them, we'll miss the point. I think we have a good opportunity here to start rebuilding trust in the community. And if we don't do it the right way, we can do more harm than good. And I think, the health department has really aimed to pose itself as a trusted entity in the city of St. Louis as it relates to public health information. And so we don't want to undo a lot of the hard work that's been done, not only by the health department, but you all as our board. So that's really where we are. And I love to get the board's thoughts on that as well.
Yeah, I'm glad you raised this issue, because so at the regional response team, we've been talking about who's most likely to respond to a cash incentive. And it's likely going to be folks who are unhoused or who have economic instability. And if we're targeting unhoused people specifically, then the second step is what's the recovery space that will be available to them once they're vaccinated. So we've tried to organize vaccination events for unhoused, and the primary concern is if someone develops symptoms and they don't have a roof to go to, how do they manage that and navigate that when they're not in shelter. So one of the things that we've been thinking about is if we are going to proceed with cash incentives, we have to be prepared for the folks who will likely take advantage of that so that they have the full support that they need to actually be successful in receiving the vaccine and being able to recover from any symptoms that they might experience. And then the second point to that about the trust factor, what we hear from folks is even if they're hourly workers, there's a concern about missing time from work. And I wonder if there's an opportunity to incentivize employers to allow people to have paid time off for more than just getting the vaccine, but for the days that follow, the 1 or 2 days that follow. So I don't know if it's structured in such a way that the incentive has to be to the person being vaccinated, but if there's an opportunity to think about how we incentivize employers to allow more time off for vaccination, then I think that would be a good strategy as well.
As we're even encouraging organizations that pool and redistribute sick days that were not used to allow them to redistribute those sick days for COVID vaccinations specifically, or come up with some policies that allow individuals to have time off, and hopefully that would actually set a precedent or something employers would think about even when individuals need to get other healthcare services that are still plaguing the city, like colonoscopy and other things like that. But if
Right.
we could work with employers to figure out how to make that happen, that would be great.
I think one thing that helped with the CARES Act legislation was that there were provisions made in that legislation for time off for individuals who were either quarantined because of COVID-19 or if they were infected by COVID-19. But those same provisions, I don't think made it into the. I don't think those same provisions made it into the ARPA legislation. So now it's really up to each individual business to really work with the HR department to establish more flexible policies so that individuals aren't unintentionally penalized if they're exposed to and infected with SARS-CoV-2.
Any additional questions or discussion?
Sorry, Rhonda. Good morning.
Go ahead.
I just shared an article from Missouri Independent about the behavioral health crisis pertaining to children in the state of Missouri. So I just encourage everybody to read it. It's very short.
Thank you for providing that. It's in the chat, everyone. Thank you, Alma.
Sure, thank you.
All right, so our next agenda item are the board reports. So do we have a report from the Governance and Nominating Committee?
Linda, we cannot hear you.
Is that any better?
Yes.
Yes.
Now, thank you.
Sorry about that. So our committee has, as you know, has been working on trying to go through different processes to change our charter. We remain the Board of Health, Joint Board of Health and Hospitals of the City of St. Louis. The variety of machinations that had to occur for us to become the Board of Health. We're sort of in a holding pattern right now because of the change in mayoral administration. So we're in a bit of a holding pattern. Also with regard to new board members for next year, for one thing, we don't really know how many board slots we're going to have until we know what changes might happen to our charter. Assuming there are no changes in board slots, we have very few people, possibly only one rotating off next year. So not a big push for new board members for 2022. So that's all I have today.
Thank you. Any comments or questions? Great, thank Thank you, Linda. Academic Public Health Collaborations Committee.
Good morning, thank you. So the Academic Health Department is working steadily for the first annual conference on October 13th through 15th. And so shortly you should be getting a save the date for that. That'll be in the mornings. And primarily looking at local public health. I guess this is sort of hopeful, looking at local public health after the pandemic. The role of academic health departments in social justice and racial equity, and the resilience for the public health workforce. In addition to that, there's been work with regard to the internship program, thanks to our partners over at St. Louis University and Janine Irigi, and Dr. Eccles is working with the union because those particular the policy with regard to internships and preceptorships may change in some regard, some of our work efforts within the department, but it's so very important, as we all know, with regard to the pipeline. And then also looking at other issues around policy and workforce development. At the moment, I think that's where we stand with regard to the academic health department. Thank you.
Thank you, Craig. Any questions or comments? All right. Communications Committee.
Good morning, everyone. We met on Monday via Zoom. We had perfect attendance, which was awesome. We talked about 4 issues. The public information team and even epidemiology staff are working on a survey of citizens in our city to identify 2 additional topics to focus on communicating about in the next year. So we're going to fan out and working with other partners, and hopefully the alderpersons in each ward get lots of citizen input. Serena is involved in a contract to do some door-to-door canvassing, especially in, I believe, some of the wards where we've had low vaccine uptake. And so we'll be able to go actually door to door in some cases and get some surveys conducted with workers. We also talked about how to leverage the Humans of St. Louis publicity campaign of our board members. Dr. Mahdi has fantastic connections with the media and gave us some good suggestions about how to do outreach as we begin to launch that profile content over the next few months, starting, I hope in a couple weeks. We also talked about ideas to recruit a communications/public health intern to do ongoing social media communication with Kim and Harold in our public information team. We're hoping to be able to pay, starting in the fall, pay an intern an ongoing stipend to do that, but we're going to look into relationships at Harris Stowe, where several people have no department heads who can give us an intern who will help amplify our communications efforts of the department. And then finally, Dr. Blue suggested that we get back to the alders who we had intense conversations with last spring about who's getting vaccinated and why not. We're going to have a Zoom meeting on Monday, hopefully, with Alderwoman Ingracia, who's now head of Health and Human Services in the city, to ask her help, her ideas, to discuss getting the alders to help us recruit survey participants in our citizen survey. And also after that, to recruit for each alderperson to set up a focus group or 2 in their ward so we can have actual conversations with citizens ward by ward to give us more qualitative, anecdotal and conversational input into awareness of the department and citizen priorities for what we need to be talking about and doing. And again, continue to engage the public in understanding more about the health department, a campaign that Dr. Ross has been talking about forever, and we've been slowly working on for the last few years. I think that's it. Does anyone have any questions? Thank you.
Thank you, Lisa. All right, I see some, I think there's ad hoc committee participation. We are still working on developing ad hoc committees when needed. I think that that's still pending. Any departmental updates? Or I'm sorry, I just want to go back to make sure we did not have any questions for Lisa about the communications committee. Great. Dr. Eccles, any departmental updates?
It's just a couple. So as you all know, the fiscal year for the department started on July 1. So we have our allocation. We received about a $4 million increase in revenue for public health initiatives in general revenue. Including that were several programs. So one program is a supportive reentry program where we'll be helping individuals who are released from correction facilities to reacclimate to society. So connecting them with the services they need, whether it's medical services, mental health, et cetera, as well as any other types of support. So we'll be working to get that program up and running. We'll also be establishing, it's a community health worker program. And this program in particular is funded through the ARPA funds, but we're going to be trying to identify ways to make sure that's sustainable beyond 2026. The health department also received several new positions for some of the pre-existing programs. For example, our animal care and control program received 3 additional animal care and control officers, and so we'll be looking to bring those positions, hire those for those positions. And we'll also be looking to bring on additional environmental health officers, which are individuals that serve in the food and beverage safety program. So they go out and inspect restaurants. So based on the data that we've had for the last several years, the city has kind of lagged behind in its ability to investigate or inspect restaurants in a timely fashion because of the caseloads that staff will have. And so having these additional positions will help us move towards better compliance with FDA standards.
Any comments or questions? Okay. Old business. All right, we'll move to announcements. I see Dr. McBride has put an announcement in the chat. Do you want to tell us a little bit more about the WashU Institute for Public Health Conference?
Oh, I just wanted to make sure that everybody had that date saved of October 27th. We checked to make sure that it was not the same days as the other public health conference, so that's great. I don't know if I know the theme of the conference yet. I can get back to the board on that. Do you know what it is, Will? Have you heard?
I haven't heard.
Yeah, when I know the theme of it or know more about it, I'll let the board know what it is.
Thank you. And Craig, could you remind us the date of the other conference? Make sure we have them both on our calendars.
Absolutely, I'll put it in the chat.
Thank you. And also note on the during the Public Health Institute for Public Health Conference, Dr. McBride is coordinating a second meet and greet of the city and county board, because we are intending on having some more collaboration as public health issues do not respect county and city borders. So we are going to have an initial meet and greet with the city and county boards, either end of August or beginning of September. And we will also do some kind of joint session that Dr. McBride is going to get tell me if I'm misspeaking, Dr. McBride is going to get some time scheduled for us on that date. So
Yep, that's correct.
okay. All right. So if there is nothing else, we have our next board meeting on August 19th, 2021. So if there are no other announcements or questions or comments,
Dr. Blue, one quick question.
Close the public part of our meeting.
Dr. Blue, one quick question.
Yes, sir.
we know that the National Association for Local Boards of Health, they have annual meetings. And so I'm not sure if we've had members of our board attend those conferences or those meetings regularly. But if there's interest in that, I think the health department will be interested in working to support that.
And they have an annual conference, August 2nd and 3rd, and I will look into that and I will send an email to the board. Thank you for bringing that up. I was unaware. I will look into that and I will send an email to the board about participation, and we'll see if what the opportunities are for the board members. Thank you for bringing that up. All right, so now we are going to transition to the closed meeting. So for our attendees, thank you so much for coming to the meeting. And I know we needed a couple of moments to transition from the live feed to our closed meeting. So thank you. We'll just take a 1 or 2 minute break.
Rhonda, it'd probably be proper to have a motion to move into closed
I'm
session.
sorry. May I have a motion to move to the closed session, please?
So moved.
Second, please.
Second.
Second.
Thank you. So we are
You need to vote. You need to call for a
vote.
vote.
Oh, sorry. Vote.
All in favor?
Favor.
Aye.
Any
Aye.
against? Any against? All right, so moved. And we will, everybody can refresh their coffee. I think that we need, from a tech perspective, we need a couple of minutes. So you can refresh your coffee or your tea until we get notice from Kim that we are ready for the closed session.